Hi, it's Monica May. On this week's One Take Live, I'll introduce you to Dr. Tracy McIntosh, the Associate Professor and Dean for DE&I at the UCF College of Medicine. Hear how this sister is advocating for changes for better health outcomes and teaching students how to be better at their craft. You gotta meet her. And tonight you will get a chance to do exactly that. Good evening and thank you for joining us tonight for One Take Live. Our guest, Dr. Tracy McIntosh, is more than a professor of medicine at the UCF College of Medicine. She brings years of experience in emergency medicine, which includes exemplary bedside manner and genuine concern for the patient as a whole being. And that's something we don't hear much of. So much so that she brings her passion for medical education and fairness of treatment to her position as not only a professor at UCF, but also an advocate for community health and how mixing the two can lead toward reducing patient disparities in healthcare. Well, how does she do it? We're going to find out. Good evening, Dr. McIntosh. How are you?
Good evening, Monica. Nice to see you. I'm so happy to have this time to chat about these important issues as they affect our community members.
I do want to give a little bit of a backstory on how we met. Dr. German is the dean of the School of Medicine or the College of Medicine at UCF, and she was given the honor of being Woman of the Year at the Women's Executive Committee event a couple of weeks ago, we'll say about a month ago or so. I was honored that evening too, and I walked over, introduced myself to her, and I feel like there was an instant connection. Health disparities are very important, especially for one when we talked about maternal mortality, but that was another story. She invited me out to the College of Medicine, and I walked in the door and I met this fabulous young woman here that we're going to introduce you tonight. Dr. Tracy McIntosh has an amazing backstory that I'd love for you to share. Who is Dr. Tracy?
I am a doctor practicing emergency medicine here in Central Florida, and I have my dream job as being Associate Dean for Diversity, Equity, and Inclusion at the College of Medicine, where I get to blend my passion for social justice, anti-racism, health equity with the clinical work that we do in our hospitals and with teaching at the bedside. I'm from Toronto, Canada, and my parents immigrated to Canada from Jamaica. And early on in my life, I knew that I loved science, I loved math. And so the only career I knew really that allowed expertise in the STEM areas to really flourish, my view was so narrow. All I knew was being a doctor. And so that was a path that I took. And I studied physiology at the University of Toronto, but I was passionate about issues of social justice. And so I did a second major in equity studies. And at the time, I didn't know how I would make that into a career, but I knew that those are two parts of my life that I wanted to explore in a profession some way. And the way that I went about that was I ended up doing a degree in public health, learning about population health sciences and about how to make communities healthy, and ended up going to medical school, thank you to scholarships. And uh, I landed in emergency medicine because what I loved about the field was the commitment to service, that we're the safety net for healthcare, but also so much more. The safety net for social issues, for unhoused folks, for addiction. And our mantra ultimately is anyone, anything, anytime. And our doors are always open, and we provide care to our community regardless of insurance status, regardless of documentation status, regardless of what the complaint is. We're a place where every single person in this community knows that our doors are open and they will get great care. And so that's how I found myself, from a passion for social justice, a love of science and math and medicine. And in my current role as Associate Dean for Diversity, Equity, and Inclusion, I oversee our programs around pathways to medicine for folks from underrepresented backgrounds, especially Black, African American, Hispanic, and Latino. I oversee our programs supporting students in high school from underperforming high schools, Title I high schools, who know that they would love to be in the field of medicine, but they have no idea how they're going to get there. Our programs are for them. We have programs at the UCF main campus for undergrads, especially those who are first generation college and they don't have mentors in their family who can get them from A to B. For students who come from low socioeconomic status and don't have a lot of mentors in their families and their social networks who can get them there. And for students who are passionate about doing the work of health equity and ending health disparities in America. So we have programs to help to make sure they can find their way into the College of Medicine.
That was a wonderful mouthful, and I love the story. One of the things, and I'm going to take you back through it just a little bit. One of the things that she said was that she had a stay-at-home mom, and that stay-at-home mom really stressed that education was super important. And her first trip, really recognizing her pediatrician as a doctor, that was what really gave her her thirst to go into medicine. And I found that interesting because she had the kind of mom that was so serious that even on summers you were reading and studying and visiting and getting a grip of a grasp of the larger world. And that's really important. You mentioned the fact that you really want to go into inner cities, especially Title I schools. And sometimes that emphasis is not there. And it's not because the parents don't want to, it's a time factor. But being able to see someone who looks like them, you saw your pediatrician and immediately linked in on that person. And that's a wonderful thing. And I love the fact that Dr. Tracy and her staff and students from UCF will come in to the Central Florida communities, the Title I schools, and they will talk with your students about what their interests are. The other
Mhm.
important takeaway for me, when you mentioned emergency medicine, it's care for all, no matter what. Well, we didn't discuss this before, but we live in a state right now that things are very difficult. And I think that what I like what you're doing is you are pushing past the typical biases that one might encounter when they see a patient who may be addicted, who, how do you know if a person can pay or not? But just the feeling sometimes that we get that leads to health disparities. How are you training your students to
Mhm.
look beyond that? Because that is so
Yeah.
key.
Monica, I'll share a story about my own experiences. I was grocery shopping a few years ago with my three young sons, and they're crazy, trying to grab things off the shelf and acting crazy, but not more than an average kid. So I was pushing my buggy up to the conveyor belt, loaded all of my items, and the cashier checking things through. As I approached to pay, she asked me the question, "Will you be using food stamps to pay for this today?" And I
Mm,
was a practicing physician, uh, assistant professor at the College of Medicine. But the way I looked, the color of my skin, the number of children that I have, and in her, it triggered a bias. I must be on food stamps. I must be on social welfare programs, these essential programs that serve a purpose in our community. But the question that arises is if that's the bias, that's the assumption that this person had about me in the grocery store, how do these same assumptions impact patient care in the obstetrician's office, in the emergency department? Because these are biases, unconscious stereotypes, prejudices that we all hold. None of us is immune. But what matters a lot is if it impacts the decisions I make clinically for my patients and ultimately the outcomes, then I have a duty to address that as a physician. My role as an educator at the College of Medicine is to address it in my students through didactics, through lectures, through workshops, which we have at the bedside when I'm teaching in the emergency department, trying to address them, be self-reflective in myself, but also address it with my learners, and importantly with my colleagues, other faculty who have been
mm.
practicing longer than I. We are trying to create a culture in medicine of being learners, lifelong learners, and that I understand that I'm not perfect as a mother, as a human being, and importantly, as a doctor. And I have work to do in myself.
I think we all do, Dr. McIntosh,
Mhm.
and that is why I really wanted to have you on tonight to just
Mhm.
know that there could be in this 21st century a role of doctors, a slate of doctors that are coming out better trained, better equipped
Hopefully.
to
Mhm.
change the outcomes. Because if a person feels good, about going to the doctor, then they will follow through. There are so many times and so many instances where you'll be in the emergency room and that person is talking down to you, or they're
Mhm.
giving you clipped responses. That doesn't make you feel good, on top of the fact that you don't feel good, if you know what I mean.
Yeah. Yeah.
So you leave there, you've got a band-aid for what you came in for, but you may never go back for what you
Yeah.
really need. And I say that because in that grocery store, um, you could have just slammed down everything and marched out. What did you say to her? Did you say anything?
Yeah, I've had a lot of experiences with addressing this with patients, with the community members, but in this moment with my sons and that I have to keep control of, I flashed my credit card and said, no, actually, I'll be paying with this, this
Hmm.
credit card with a high annual fee, and moved on with it. And so I just chose to just address it in the moment, but I chose not to confront and address
Hmm.
her as being a person with prejudice in that moment. But sometimes those are the types of actions that I do take with patients and with colleagues. But in that moment, with my children around, I just chose to move on. And every situation is going to be different. Oftentimes, I train our learners in the moment may be the best time to address prejudice, microaggressions that you face, but other times it may be best to think about that, to draft it in an email, especially when there are issues of hierarchy, which is part of medicine. And you may not feel it's the best time to call out a surgeon when you're a student in the middle of the operating room, but we provide skills, scripting, and workshops on when is the best time to address a microaggression, so that the team members can learn from it in a positive way without putting my guard up, without being defensive, but instead giving me a chance to say sorry, to say thank you for addressing it, and for allowing me to have this conversation, which is a very vulnerable place for a learner to be in.
We are speaking with Dr. Tracy McIntosh. She is the Associate Dean of Diversity, Equity, and Inclusion at the School of Medicine at the University of Central Florida. One of the questions that just came in is, Dr. Mack, can you explain cultural humility versus cultural competence?
Very good question. So, in our curriculum for medical students, for faculty, we are focused on cultural humility. Cultural competence is along the same veins, but it's an older terminology that we are a little bit critical of. Competence, I'm training our students to be competent in the management of asthma, in the management of stroke. That means you understand the physiology, you understand how it presents, and you understand how to treat it.
Mhm.
It presupposes that you will be expert in it. I cannot teach my students to be expert in the cultures of every single patient that ever presents for their care. Instead, I can train you to be curious, to ask questions, to identify that each of us has our own culture. Many of us identify with the dominant culture in medicine in America, but each of us has our own cultural identities that are unique, and that the patient who has a different culture is not the other. And instead, it recognizes that each of us has a cultural identity, and that we need to be curious, empathetic, and inquisitive about our patients, instead of thinking, oh, I know how every patient from this country will present. Oh, I know every patient from this culture is exaggerating when they have this complaint. No, instead, ask questions, treat each person as unique and as being an expert on their own identity and on how the disease is presenting for themselves. And so cultural competence is a similar vein, but it presupposes that you can be competent and know everything about other people's culture, which we cannot.
Mhm. You've had that said to you by faculty members, "Oh, I treat everyone the same," or
Hmm.
some students may have even come across as, "Oh, there's no difference." And how do you manage that? What's your response to
Hmm.
that?
Yeah. So that's a fundamental question about the difference between equality and equity. And I find more and more folks are understanding these nuances, but equity is where we want to achieve. So I'll give you an example, a clinical example, but I'll make sure that folks can understand it. So let's say that a patient presents with a blood clot in their leg. So maybe they had a recent surgery on their knee, or they took a long flight, but they develop a blood clot in their leg. Equality means that I have two patients, I write a script for a blood thinner, and I send them on their way. Equity means I try to understand what are barriers that a patient may face to being able to fill that prescription and to be able to be treated, really. And so requires that a doctor understands, do you have insurance? Will you be able to pay for this very expensive medication in America? Will you be able to follow up with a doctor? Do I need to make a phone call for you to your primary care doctor to make sure you can be seen? Do you have transportation to be able to see your doctor? Do you have paid sick time to be able to make all of these appointments? These are all things that are barriers to care for some of our patients. And so you can see from this example that equality prescription out the door will actually lead to more complications for certain patients without a real understanding of the structural issues that individuals face in our community that are barriers to care. And so my role as an educator, my role as a doctor is to see the whole patient. And if there are barriers, then I want to be able to help folks. And I have resources within our hospital to do that, but it means a mindfulness to be able to address those things.
I
And so
love
folks,
the word mindfulness because people are
yeah.
using that a lot.
Hmm.
Um, and I didn't mean to step over you, but I
Hmm.
do want to say this. As African Americans, especially as Black Americans, we use the emergency room as our primary care facility. And we are hoping that with bringing UCF College of Medicine into our community throughout Florida, that we will be able to stop that. You and I talked also about we have many facilities that are free or on sliding scale fees that we need to utilize even more. Let's talk a little bit about that and how your students can make their way into that. And we as the community need to use them more.
Hmm. Um, w- Among the reasons for disparities in, for example, cancer mortality between Black African American patients and whites, as a reference, for example, is screening. So we're not getting our screenings the way that we're supposed to, and leads us to be diagnosed later in our diseases. And so our chances of a full recovery, of remission, of cure are lower. And so making sure that folks know about screening events when they come around, usually every October for breast cancer, for example, but know about our community health centers, federally qualified health centers, like the health department, know about Orange Blossom, True Health, so
Right.
many clinics around Central Florida that have a mandate, have a commitment, and a passion for providing care for folks who may be uninsured temporarily, who may be undocumented and are still working towards getting established benefits here in the US. We have resources in the community for folks so that you don't delay treatment for conditions that are chronic and end up actually having more complications from untreated blood pressure, for example, or untreated diabetes that can really be life threatening if it's ignored for months and years. And so we would love to raise awareness about all of these clinics around Central Florida. The College of Medicine, we have some free clinics available as well throughout Central Florida. We have a farm workers clinic in Apopka. We have a clinic for folks who may be unhoused and suffer from foot wounds. And we have a primary care clinic as well. And so we're trying to do our part, our best to provide some safety net for folks who may be between jobs, who may be uninsured, undocumented, or here temporarily. And so those are some of the ways that we're trying to support this local Central Florida community. I'm also excited about a new mobile health clinic that is
Yes.
coming out next year to see how we can get into communities and overcome some of the barriers around transportation, people not being able to take off too much time off work to be able to get their primary care appointments. So those are some of the exciting things that we're doing at the College of Medicine to support and to address the issue of access to care in Central Florida.
One other thing that I think our community needs to really understand is the impact you all are making with those schools, those students in those schools that are Title One, that do have those desires, those goals, those dreams of being a doctor, even being a nurse, because there is a new nursing facility that's coming out to the College of Medicine. So we just want to open up all of this and find out how we can get connected with the College of Medicine. After we had our first meeting, I immediately reached out
Mhm.
to the student that I mentioned to you, who I know is interested in becoming a doctor. And her mom was like, okay, I'm going to be listening. I'm going to make sure that I'm there. I'm tuned in. So,
Yeah.
how do we connect with you to find out how to get you and some of your staff and students
Mhm.
out to some of these schools to talk with some of these students?
We love to do road shows. We love to bring our anatomy demos to local high schools. And so please just email me. I have a team here at the College of Medicine of faculty, so already doctors and students who are happy to come out to our high schools, come out to our middle schools, and do presentations about healthcare, do clinical skills training workshops about how to take blood pressures, and to really answer any questions that students have about how do you find your way into these healthcare careers. I speak for myself and I speak for a lot of my colleagues when I say that so many of us are on the path that we are on because one person came out to us, one person said, if I can do it, you can do it. And so this is part of how we keep our cups full, really, is by coming out into the community and being there for students and helping folks find their way to their dreams. um, we know that there's great minds, great doctors everywhere, every school, every community, every zip code. We know that there's barriers to students finding their way, and our goal is to help students overcome those barriers.
So, would your email be tracy.mcintosh@ucf.edu?
That is it. That is it. It's
Okay.
Tracy, TRACY, and MacIntosh is MACINTOSH.
Okay, and then I would also suggest that you go to the ucf.edu website in general. Once they're there, what are they looking for to get specific to the College of Medicine?
So if you put into your search bar UCF College of Medicine, and my office is DEI, diversity, meaning we were looking for folks with different lived experiences, different backgrounds, different identities. Equity stands for making sure that we're addressing health disparities, increasing health equity, and inclusion means that everyone who is here feels like they belong. And so DEI is the acronym that will help you find my website, and our programs there are under pipeline. For students who are a little bit more committed to medicine and have 1 week in the summertime, Monica, please look for our Health Leader Summer Academy. It's a 1 week summer camp. It
Mhm.
is free. Our commitment to this community is that we will always offer this as a free program for students who are passionate about health equity, students who want to learn clinical skills, students who want to meet mentors, students who are interested in research, in innovation in healthcare. And so that's a 1 week in person summer camp. We go to the College of Nursing, we go to the College of Engineering, the College of Health Professions, so athletic training and other ancillary specialties, getting a chance to go to all of these different parts of UCF and exploring and meeting mentors there. So that's 1 week in person. We probably be opening those applications in February 2024. So please keep that bookmarked and check in with us again in February.
That's a wonderful thing. I wanted to go back now to talk about you all have surpassed the 10-year mark of graduating students from the College of Medicine. And that very first class, these were the best and the brightest from around the country. They got their degrees for free. Dr.
Mhm.
German was very just dead set on, making this thrust and making it count. Let's talk about good old Dr. German for just a moment. She's a
Mhm.
wonderful lady, full of energy too.
Absolutely. So to start a medical school, that requires that students take a chance on a brand new institution. And so, in order to make sure that the students who come here would be successful, we needed to have a carrot in order to bring students to a brand new medical school with faculty who had not signed on yet, with a hospital program that was just in its fledgling forms. We were still establishing relationships with our clinical partners. And so it's a certain type of student that's going to take a chance on a brand new medical school. And Dr. German wanted to make sure that we still had great students forming the first class and being mentors to the next class and subsequent classes. So, with partnerships, with great philanthropy, we were able to offer full scholarships, which means tuition and room and board to that first class of medical students, who has formed, the first class of alumni, and is many of whom have stayed here in Central Florida, which is a key mission for us. We would love to send students around the nation, but really our passion as a public medical school is to make sure that we are filling the need and the void for physicians here in Florida.
This is an amazing thing. Something else that the College of Medicine from at UCF is doing for our students from Bethune-Cookman University, for FAMU, U of F, getting into medical school is very difficult. And they are doing workshops, webinars actually, to assist in that. Tell us a little bit about that.
Yeah, we would love to have every student come to our campus and see our facilities and engage in our clinical workshops, but we know that that's not possible. Folks are far away studying, and so we wanted to get our key focus is access. We wanted to make sure that students at other schools, especially who don't have medical schools attached to them, can still understand what they need to do at the undergrad level to get into medical school. And so we have a webinar series that you can access it through my website. It's open to anyone. Actually, if you're in high school, you could participate in this too. We don't shut anybody out, but you can come every month and we break down the process of the medical school application into bite-sized, digestible pieces month by month and work through them. And so we talk about academics. What kind of GPA do you need? How do I get there? Right now, I'm struggling with biochem, and we provide support and mentorship because we've all been there. We've all had struggles and we've managed to overcome them. So we provide mentorship on that. All right, how do I find a research mentor at my college? I don't know how to do that. I don't know how to send that first email. We got you. We provide mentorship and coaching around all those areas so that you can build a successful application, hopefully to my medical school, but to any medical school, we're happy to support.
What brings you the most joy out of interacting with these students, from the emergency medical side of what you're sharing with them to bedside manner? What brings you the most joy? What makes you get up and say, I'm ready to tackle
Mhm. I'll share with you a story from a new program. We're always happy to partner with folks in the community, organizations, companies who want to lean into our work. And so this summer, we were able to get scholarships to set up a new summer research program. So we had scholarships for 6 undergraduate students here at UCF. And so in the summertime, folks, oftentimes students just need to make money. And so they'll get a job working in fast food or in retail to make some money so they can pay their tuition. So thanks to this grant from a donor, we were able to provide scholarships so students could do research over the summer.
it? Hmm.
And all of these students chose to do research to address health disparities. And this summer they did presentations to a whole room full of students, and these student researchers came up to me at the end of their presentations and said, thanks to this scholarship, thanks to this summer research program, I know my place in medicine.
Mm.
I'm passionate about my impact to help my community to overcome these health disparities. And so all the time spent fundraising and putting together this program, this is the impact that fills my cup and that allows me to go back to the drawing board, go back to see how can we grow this program year over year so more students can have that impact, more students can have that experience. Because for a student to see how they're going to have an impact on the field of medicine, how their perspective and experience matters, this is the most fulfilling thing for me from this summer's experience. So I hope to replicate that, and I hope to give it to more students.
And I hope that more students will take advantage of all of the lessons that can be gained and all of the time spent out at
Mhm.
UCF College of Medicine. I thank you for what you're doing in terms of trying to do it one student at a time, one faculty member at a time, because you're changing their outcomes as well. And when you change that and you give a person a perspective of looking at me for who I am, a whole person, I bet you the health disparities can shift a little bit. Stay connected with us, please, and we'll stay connected with you. Again, Tracy.McIntosh at ucf.edu, the Associate Dean for Diversity, Equity, and Inclusion at the University of Central Florida College of Medicine, Dr. Tracy McIntosh. Thank you for being with us, and thank you for sharing all of this information. And I thank you for watching another episode of One Take Live. I'm Monica May. Thank you.
Thanks so much.